Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer, Program Director, Associate Professor of Medicine. Today we're going to continue our in-service training examination topic in internal medicine. Just one more point, again, very, very important if you're an internal medicine resident to score very well in the in-service training exam, okay? Internal medicine residency is not very easy. So in order to impress your program director, get into high fellowship, all of that you need to is very important. In-service training exam in the clinical competency committee, they look at it. So we're going to go through the topic. We're going to continue our nephrology topic. Today's topic is how to diagnose the multiple myeloma related renal injury. Okay, so let's start with the case. The stem first. A 68-year-old male present with the fatigue, bone pain, decreased urinary output. He's also complained of generalized weakness and noticed reduction in the urine volume over the past few weeks. Physical examination reveals pallor, bilateral leg edema. Lab finding is hemoglobin 9, serum creatinine 3.8, calcium 12.0, serum protein electrophoresis showed monoclonal spike. There is protein in the urine, 24-hour urine protein, the Benz-Jones protein detected. The question is, which is the following is the most appropriate diagnostic test for the patient renal injury? And they give you like 4 choices: renal biopsy, serum-free light chain, abdominal ultrasound, and bone marrow biopsy. Okay, so what is the answer for this question? Okay, the answer is you got serum-free light chain assay. Okay, that is the answer. You have to go by serum-free light chain assay. That is the diagnostic criteria. Don't pick the biopsy. Now, what happens is look into the pathophysiology. What exactly happened in multiple myeloma associated renal failure? You got this something called a cast nephropathy from this free light chain deposition or Benz-Jones protein. Okay, they precipitate in the renal tubules, and then diagnose the term you need to know, the cast nephropathy from the free light chain. Now you have what will you have? You got you got like selective proteinuria, and then you got free light chain, the diagnostic test with a limited albumin excretion, typically less than 10% of the urinary protein. We talk about serum free light chain. If you want some numbers, greater than 500 to like 1500, and the urine light chain is greater than 1 gram per day. Okay, that is the diagnosis of serum. Now the question, the confusion arises like, should I pick renal biopsy? No, because the free light chains is enough to diagnose. The only time you will do a renal biopsy because you have non-selective proteinuria or significant albuminuria, and you don't get a good serum light chain assay, then you can do the biopsy. Okay, the answer is light chain cast nephropathy. So anytime you're thinking about multiple myeloma associated renal injury, when you have to talk about this light chain deposition cast nephropathy, it should come to your mind. Okay, so we're going to do like some of the questions. Now you got a 67-year-old male, multiple myeloma history, worsening renal function, serum creatinine 3.5, calcium high, serum electrophoresis M spike is there. There is 4+14. So what is the most likely cause? Again, light chain nephropathy is the answer. Okay, let's go to the next question. These are all board review questions. 65-year-old male came with a multiple myeloma present with acute kidney injury. Creatinine is 5.1, calcium is 14, albumin is 3, urine protein electrophoresis is positive of Benz-Jones protein. Which of the following is the most likely cause of renal injury in this patient? In this patient, the answer is in this patient, the answer is hypercalcemia induced nephrocalcinosis. It's not the light chain nephropathy. Okay. Now the next question: a 60-year-old patient with a multiple myeloma present with fatigue, nausea, decreased urinary output. Lab results are as follows: serum creatinine 4.5, calcium 11.8, and serum free light chains. Anytime free light chains are there, again, you know this is cast nephropathy. And how do you treat it? Multiple myeloma, you give IV fluids and chemotherapy is the answer. Okay, Let's go to the next question. A 68-year-old man with a multiple myeloma, worsening renal function, he got calcium is high, serum kappa, light chain is high, okay? And then you got urinalysis, it's got protein light, diagnosis again, light chain Cas nephropathy. Anytime serum light chain is high, think about light chain Cas nephropathy. That is the diagnosis. Multiple, the point is we're trying to teach you multiple myeloma associated renal injury, and that is the light chain Cas nephropathy. I want you to remember that, okay? Now, next question. 64-year-old male with a multiple myeloma, newly diagnosed AKI, serum creatinine is high, calcium high, albumin is 3.1, seroprotein, you got monoclonal IgG, M spike, positive of Benzos protein. Again, what is the cause for this patient? Again, you have to say because of Cas formation due to light chain Cas nephropathy is the answer, okay? Next question, you got a 61-year-old woman with a multiple myeloma, fatigue, serum 5.8, again, calcium is high, renal failure, serum free light chain ratio is high. Most likely, what will you find in if you do a renal biopsy, you will find a light chain Cas nephropathy. You don't need a biopsy as long as serum free light chain is positive, okay? Another question, 59-year-old male with a newly diagnosed multiple myeloma, back pain, fatigue, again, creatinine is high, calcium high, serum light chains is high. What is the most likely renal pathology? Again, causing this AKI, again, Cas nephropathy due to light chains, okay? That is the answer. And one more question, 64-year-old woman with a 3-month history of multiple myeloma, you got renal failure, you got calcium high, again, light chain is high. What is the most likely cause of acute kidney injury? Again, light chain Cas nephropathy, okay? So all of this thing, the point we're trying to make up here, multiple myeloma associated renal injury, think about light chain Cas nephropathy. That should be the answer. Don't go for the renal biopsy. Check the serum light chains, okay? Please, like, share, and subscribe our channel. It's very, very important. There's a lot of topics we wanted to do. Without your support, we won't be able to do. Let's all study together, be the best physicians we can be, okay? Thank you so much for watching. God bless.